A very warm welcome and a good evening to yet another exciting episode of our technology show Innovate, where we bring you nothing but the best in the world of technology, both here in Uganda as well as globally. Of course, with yours truly, Brenda Kembabazi. But first, a sneak peek of what we have on the show for you tonight. This week on Innovate, we bring you the technological innovation that will bring an alternative to saving patients for long waiting times. Also, the mobile hackathon competition that brought together over 70 mobile developers. And for Global Tech, it is the Taiwanese company Gogoro that has rolled out an all-new electric scooter called the Gogoro 2 Smart Scooter. Now, patients will be able to access their data, their information at various hospitals without having to go through long queues with the ClinicMaster, a mobile-based application that will help them be able to cut on the time that they would be spending making up lines in order to be able to see their doctors. Now, we bring you how it works and just how it might help the health centers and facilities here in Uganda. It is a common sight to see long queues and medical personnel taking down details of patients at most health centers. These records often will be filed and kept for future reference. This old-time technique is soon fading with the introduction of a new application that is capable of storing patients' data on a system rather than on paper. Dr. Ssenoga of Case Hospital explains that previously a lot of time was lost in retrieving records.
We're using the usual, we are doing like everyone else would do in the hospital. We are using the files and the papers. For example, if you came to hospital, you come to our receptionist, we register your name, we make for you a file, or if you are visiting, it's your second visit, we have to run to the store, look for your records, because in medical, while we are treating patients, it's very important that we get your past medical records before we treat you. So that caused a lot of waiting times, prolonged waiting times. And of course, patients, you come in the hospital and you are sick, you have pain, the last thing you want is waiting, prolonged waiting. So this caused a lot of waiting, and of course some records would not be found, and such problems. But with ClinicMaster, it's all digitalized. If you come to our receptionist, you get a number. And with this number, you are able to, we attach on all your particulars to this number before you see the doctor. He also says that with the new system, time can now be saved, and the doctor only has to click to view information about his patients. Really, because it has great advantages, in a small place like in Kamuli, I would imagine even medical personnel would be interested in knowing the past medical history. Here, the keeping of records in many of our facilities, big or small, is not so good. And you agree with me that they are quite important as far as treatment of patients is concerned. And since we are also reducing on the waiting times, it's quite an advantage. So it is user-friendly, it's easy to learn and easy to run. In a place like Kamuli, all the staff can learn it and quickly upload whatever is uploaded. And then the doctors, they find it very, very convenient, because then the doctor will have your results all at the same film, even your past treatment, even the drugs he gave you previously, so he's able to adjust the treatment. Dr. Ssenoga says that the system is locked with a password for the authorized medical personnel, therefore no chance for compromise on the patient's confidentiality. Yeah, that goes back to our training as medical personnel. We swear to a Hippocratic oath. We are supposed to have secrecy. And this system is so good in that they enable different people for different purposes. For example, someone at the receptionist cannot see your details. The person at the receptionist can only see your registration, age, what, that's all. Now, the people in the lab cannot see your ailment either, because they're not enabled. All they can do is to only see that part that needs them to upload the results. The doctor who is in, I've already told you, is under oath, and under oath he's the only person who can see the details, and he is the person responsible. And at that point, he's signed in, so if the message is, if the message gets mixed up at that point, because each one who signs in the system, the name records. So that means that we can track even who gave which information. But doctors are the ones who hold, and they are under oath, they wouldn't divulge the information, and the system is secure. It only authorizes people with a name, you have to have a name and a secret code, which everyone has a secret code.
The Chief Executive Officer, ClinicMaster, says this application mainly focuses on availing information of patients' records.
We are an ISO certified company and have gone from a simple electronic patient medical record system to a fully integrated health information management system that integrates different service points at the facility, such as reception, cashier, doctor, laboratory. All are able to be integrated and share patients' medical record.
Officiating at the launch of the new brand of ClinicMaster, the Permanent Secretary, Ministry for ICT, Vincent Bajiri, said government is committed to supporting innovators to meet international standards.
From the policy perspective, some of you may know, government set aside 15 billion shillings annually to support innovation in the country. And the reason for this is primarily to assist innovators in the process of their innovations to ensure that they meet international standards. And for you to meet international standards, your IP must be tried and tested, and therefore the product is good for the market in all aspects. The architecture of the product, its usability, and by and large, the fact that it may not have legal issues. Because you don't want a situation where you deploy a product and tomorrow someone comes and sues, and probably they stop you from using the product. So all those things we have looked at, and as government we are saying our contribution will be to ensure that we organize and prepare innovators to meet the IP demands.
For each user at a health facility, an initial subscription fee of 496 will be paid. The development of the fully Uganda-owned ClinicMaster system took 4 years, but it is now available as an integrated system for hospitals. Innovate now takes a very short break, but we return with much more from the world of technology, both here in Uganda and also a take on what is happening in the global world.